This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today I am really excited to have our guest, Moly Cupka, here with us from Upending Parkinson's. Really excited to have you here, Moly. Thanks for coming.
Of course. Thanks for having me. I'm really excited to talk about my favorite topic.
Yeah, and some of my favorite topics too. We're talking about rock climbing and neurology, and especially as it relates to Parkinson's, which not many people may know can be a super beneficial thing for Parkinson's. So, before we get too deep into what the work you're doing with Parkinson's, can you tell us a little bit about your story, how you got into climbing in the first place, and then ultimately into working with Parkinson's patients or
Yes.
clients?
Yes, I was a swimmer growing up. I played a lot of sports, but I swam primarily, and I swam in college in California, UC Irvine. And then towards the end of that, I was kind of looking to fill my time since I wasn't going to swim anymore. And so I picked up a rock climbing class at the college, and I was hooked right away. Mainly Mainly it was because it was so hard.
Hmm.
I get up there and thought I was athletic and good at everything. And I get up and I just, didn't do so hot my first time on the wall. And I was like, I have to go back and do that again.
Hmm.
So within a couple weeks, I was working at that climbing gym. And then since it was in California, I got to climb outdoors all over the place there. And then I moved back to where I grew up, the Maryland, Virginia area. And I took a couple years off climbing, ended up getting back into climbing, and then started to work at a climbing gym. I worked there. I've worked here since what 2007, I believe, 7 or 8. I started as a yoga instructor, and then I became a manager, and an assistant director, and then director. And so I've been the director here for a while now, and it's at Sport Rock Climbing Centers. And because I was a director here, I had the like fortune of being able to choose programming here, and the owner was always saying yes to everything I wanted to do. And so I have a big passion for neuroscience, and I met a climber that was interested in climbing here, and he had Parkinson's disease, and I thought, that actually sounds really interesting. Come on in, and it's grown from there. It's
Hmm.
just grown immensely from there.
Hmm. So it started with just one climber with Parkinson's, and you're like, yeah, let's do it. And
Yeah, exactly.
yeah. What kind of climbing was he doing? Was he doing like top rope? Was he doing bouldering?
We just do top rope climbing.
Just top
So
rope.
where the rope set up top. Yeah. The
Hmm.
bouldering, just because there's the ground fall, you know,
Right. Not
it's,
able to do. Yeah.
yeah, I'm sure we could, but I just choose not to incorporate that in. It's just much safer to be on the ropes on top rope for the climbers.
Yeah. And I know it's totally irrational, but I kind of exclusively do bouldering because I don't trust the rope personally.
No, you're a
Totally
boulder
irrational.
only.
Yeah. Uh so yeah, maybe not as fun. But I
It's
love
always funny when you hear people say, because I've heard many people say something similar to what you said, or that they have a fear of falling
it.
and then
Hmm.
they boulder. And to me, I have a fear of falling, which is why I use a rope, because you're going to fall in the air versus boulder where you actually fall to the ground.
Right. I think in my irrational thought process, I'm like, okay, well, if I fall from the height of a boulder, I'll break my legs at worst. But if I fall from the height of a top rope and the rope doesn't catch me, I'm toast. So that's
Fair enough, fair
yeah,
enough.
that that's
Well,
my irrational yeah. But that's awesome. So it started with one, and then how did it grow from there? Like, how did people find out about it? What were some of the early experiences like?
yeah, so it started with one, and his experience was really great, and he was awesome. He was a doctor, and it was fun to talk to him about everything. He was really open about it. I learned a lot from him, and he kind of connected me with some doctors and some other courses I could take and stuff to learn more. And he was just blown away by how much it was helping him. And so I was like, is this just you, or is this, a climbing thing? It made sense that it would help, but let's try it with a few more people. So we kind of recruited 3 or 4 more people and started our little small group. And everybody in the group, they're going to the doctors and saying, after a couple months, saying their doctor says they're improving with everything and they're looking better. So I was like, wow. And started looking up online and found nothing on the topic. And I was a little blown away by that. And I just figured everybody needs to know about it. I'm
Hmm.
that passionate about it, especially over the years. I mean, the further it goes on, the more I'm like, oh my gosh, this is just insane, the impact it's had on people's lives.
Yeah. And I know typically with Parkinson's kind of the exercise that tends to get recommended is like boxing or swimming, kind of this like crawl activity or this cross crawl activity or this sequencing type activity, which rock climbing has a lot of that in. You have the full body workout, arm and leg working together, core stability involved. Um, so in your studies, what are some of the, I think, neurological implications of rock climbing that you might think are helping people with Parkinson's so much?
Yeah, so I could get into the study, which isn't studying everything I would like to, test.
Hmm.
Only so much time. We're looking there at a lot of balance, mobility, really
Hmm.
things that translate to everyday life instead of being some arbitrary thing. It's, walking and looking, walking and carrying, going up and down steps, some agility testing, reaction time, fine motor skills, testing a whole plethora of things there. And then we also have some psychological evaluations for apathy and depression and those sort of things, just to see what changes we're seeing. Now, anecdotally, I've seen tons of changes over the years.
Yeah.
I could from people coming in with dementia and still having dementia. It doesn't get rid of Parkinson's. It doesn't get rid of dementia, but just you live better with it.
Hmm.
And I feel like really recently the dementia's really stuck out to me because there's a few people that are in our group and they've been climbing for a while, and it's almost like I wish I could have recorded our first conversations together because I know what they were, but just I know seeing it would just blow my mind because now
Yeah.
I'm in here having full conversations with people. They're speaking first to me, asking questions, engaging, and it's just like a whole new person, or the people that are, new people here, and it's really cool to see that part of it.
Hmm.
Oh,
Yeah, that's
I mean,
really interesting.
neurologically, climbing does so much for your brain. I mean, they've done tests on or studies on climbing in the brain. They've done showed the cerebellum's, more firing more and parietal lobe, and you know, which has a lot to do with movement and also planning and those sort of things. And then they've done studies with Parkinson's and other exercises. And I feel like if you just kind of combine those two, which is what we're trying to do, we'll show that like climbing impacts people with Parkinson's the same as people without Parkinson's, but to more of a degree because it's more important for them in their state.
Hmm. Yeah, especially as we engage our grip strength and our like those nuclei of the cerebellum have tend to have a more profound impact on kind of the areas of the brain that control like dopamine production and then frontal lobe as well. So it's kind of makes a lot of sense that, with the climbing, that's going to activate those parts of the cerebellum even more. And I think one of the things that I love about climbing is how it might be different than like boxing and swimming is that it's such a mental task too. It's not just a physical puzzle, but it's this mental puzzle that you have to figure out your route. You have to figure out how am I gonna get to the next hold, right?
100% is very top down, like cognitively involved. I mean, it's a puzzle, like you just said. It's just that's why we call bouldering problems because
Hmm.
they're a problem you have to figure out. And so you're constantly using your brain and your body's giving feedback to your brain back to your body the whole time you're climbing. And you can only imagine. I mean, so with Parkinson's, as you obviously know, your substantia nigra losing dopamine, which is in the basal ganglia, and that's your motor cortex. And then motor cortex, fires to the frontal lobe, and that's a lot of your automaticity. So, like your automatic movements, like walking and doing things, you're no longer doing them as automatically. So, you're having to rely on other structures in your brain to kind of be a little more volitional and thinking with your movements. So, I feel like with climbing, there's so much of that. There's
Hmm.
so much of the cerebellum's one of those parts of your brain that does that. And it's just, I can only imagine that what rewiring is being done in your brain through that.
Hmm. Yeah, and especially I'm sure you've noticed that the more people do it, the more benefit they tend to get.
Yeah, absolutely. I have people who've been doing it with me for, well, the first guy, he still does it. That was 2012. And then the whole crew of them that were there at the beginning, 2013, 14. Yeah, they're still climbing, and it's really neat to see. And it's also interesting because Parkinson's is progressive. So
Hmm.
people are progressing. And I often wonder, what it would be like if they didn't climb. It's hard to say.
Hmm.
Um, but it is very neat to see. I have a guy in our group who's 82 and he's been climbing since he was 72, you know.
Right.
So, and he'll
And
be continuing.
yeah, awesome. And you mentioned Parkinson's is a progressive condition. So by definition, we shouldn't expect it to get better necessarily, especially, unmedicated, etc. So if you are seeing even regression or maintenance of kind of standard of quality of life or where they were at when they started, I mean, I think that's already a huge win if you can just get them to maintain their current level and not progress further. But then if you can even get their symptoms to regress or not regress, but improve, that's something you wouldn't necessarily expect, right? With a progressive condition.
That I feel the same way. And if you ask the climbers that I work with, which there's 111 of them at the local gym that I started. So there's a lot of climbers. I say you probably get a good percentage of them. By far, the majority would say that they have improved, that
Hmm.
they not only just feel good, they feel like, they type better, they can hold things more steadily,
Hmm.
they walk better, they think better. I get that a lot when take 2 or 3 weeks off of climbing. They're like, I need to climb again. My brain's all foggy.
Hmm.
So yeah, it's agreed for a progressive disease and for people to go to the doctors and they come back to me, they're like, I improved like
Hmm.
since the last time I went. Like that's crazy because it's a
Yeah.
progressive disease and I'm doing better. Like,
Hmm.
yeah, it's pretty important for them.
That's awesome. And you mentioned they're able to type better. Do you see like reduction in tremor and reduction in like stiffness and like hesitations and things like that, and improvements in gait and quality of life? All those things you're seeing
I would
improvements in?
I would say all of those things we see improvements in. And everybody is different, and especially everybody with Parkinson's is very
Yeah.
different. And so everybody's looking to kind of improve some different symptom or a different way that they're feeling. But yes, that definitely all of those things I have heard from people, I've seen, and we are now testing, and it's looking positive.
Yeah.
So yeah,
Do you find that the earlier people start in their diagnosis journey, the more benefit they get versus somebody who might be further along in their journey?
That's hard to say. That's
Hmm.
hard to say. Um, Only because I'd have to pull up a list of the people I work with. You know, I'm thinking of a couple of them, and the first guy that I worked with, he has given me permission to use his name from now until forever, but his name's John, and he took a big chunk of time off during COVID, not
Hmm.
just the COVID time, but time afterwards. And then it's, I mean, we all know Parkinson's is not the easiest to get yourself back into something.
Sure.
And so he's had a hard time getting back into it. And our group's grown so much. And so he's kind of like, I miss the one-on-one or one-on-four, you know,
Hmm.
so many people here. And so recently I've started doing smaller sessions with him and a few of the original people that used to come in. We call them all the OGs. Well, he
Hmm.
is the OG, and that whole group is has other nicknames, but um, so he's been coming again, and yes, I would say the long-term benefits. The longer you do it, the better. I would say that, but it is
Hmm.
hard for me to say for like him because there's been such a gap. I'm thinking 6 months from now, I'd be like, oh yeah, definitely.
Sure. Sure. That makes sense. And it's hard to gauge. And how long have you actually been doing this? It's still relatively young, yeah.
So since 2012 is when I
Oh,
started
okay.
doing
That's
it.
right. Yeah,
It didn't become a nonprofit until 2022,
that's right. Hmm.
I believe. Um, yeah, but I've been doing it for a while.
Okay. Yeah, very good. And have researchers, scientists, doctors, have you been finding more interest and engagement where people want to kind of explore what you're doing more and try to see if, we can come up with a standard recommendation for Parkinson's or maybe even get insurance coverage for Parkinson's to do rock
Yeah,
climbing?
that would right. Wouldn't that be great? That's that's one of my big dream goals would be insurance to cover something like this. Yeah, there's definitely interest in it. The two uh, PTs I have doing this study with me are absolutely amazing, and I'm so lucky to have found them. And they also have a good community of doctors and PTs that they're connected with. And they post one thing, and people hear, "Oh, Andrew Guccione and Julie Reese are doing this. This must be cool. Like this must be good." And so they're getting reached out. Like people are reaching out to them quite a bit and inquiring and thinking it's interesting. And so the hope is that the study will be, you know, comprehensive and good enough with great results that people are like, oh, this is worth doing a bigger study on and maybe a more specific since it hasn't been studied much. We were kind of broad with what we were looking at.
Hmm.
Um, so that would be really, really great to have that. And I think it'll happen.
Awesome. Yeah, I think so. I mean, if you continue to see these obvious positive benefits, I can't see why they wouldn't want to explore it further. Um, and
Right.
you had mentioned, so Upending Parkinson's became an official nonprofit in 2022. What would you say the number one goal for the organization is?
Making me pick priorities here. I'm not good at this.
Or top five, whatever they might be.
I could do like top three or something like that. So one is research. I really
Uh,
wanted to do research on it. I just wanted it's been doing it over the years. It's been challenging to go to events and go to things and meet doctors and say, "Oh, this helps," and then to be like, "People with Parkinson's climbing, are you crazy?" It's gotten easier as I have more people and I can pull people into to kind of like this person climbs and they see improvements. But I just feel like with the research that it would really let people know that I don't just think it improves, like helps you and improves you, that it actually does, and we've shown it does. So that was the big goal. Another big goal is to get Parkinson's climbing groups and gyms across the country, which is something so we're wrapping up our first study here soon, and I am really doing a big push on getting gyms to open programs. I am talking with about 30 gyms right now, and we have 11 that just have been going on, have started in the last year or so, and I think we'll have a ton in the near future. That would be another goal, and making sure those programs. So the thing with starting a program at another gym is that
Mhm.
anyone can do that, right? Like you can just be a gym owner or manager and say, yeah, we're going to start a Parkinson's climbing program here. And I guess my goal would be to make sure that the program is successful, to make
Mhm.
sure that, I would hate for me to tell everybody, oh, Parkinson's, if you climb and you have Parkinson's, like it's so great for you. And then somebody in some other state goes to a gym and has a horrible experience and doesn't make it to the top of the wall or even has no success and just feels really deflated. And then it's like, oh no, this is not true, because I've worked with all the climbers I've worked with. Everybody has, succeeded. They all make it up the wall. I have people in wheelchairs, so it's been really successful, and I want to just make sure it is at other gyms as well. I'd say those are my top two goals.
Yeah. How how would you make sure, or what are some things that other climbing gyms or climbers need to keep in mind when they're working with a client with Parkinson's? How do they need to adapt their strategy, their training to make sure it is beneficial for them uh, long term?
Yeah, so what we're doing in this study, and what I firmly believe, is that climbing is innately good for people with Parkinson's. So it doesn't need to be super prescriptive. You don't need to say, you need to climb this number of routes at this difficulty, or you need to do this certain way. So that's one of the benefits about starting programs, is it's like you don't need to structure any program because it is just climbing. Now, in
Mhm.
terms of actually working with climbers, um, you and I probably know this. If you work with an instructor, they can be very helpful or they can be not very helpful. So my goal is to I have a volunteer/belaying document, and it outlines a little bit about Parkinson's, what the symptoms are, how people vary, just a little education that I feel like is important for people to have, things to look out for, possibly like blood pressure drops or, falls.
Yeah.
And then wall selection, you know, you don't want to start on a really steep wall. You want to try and first climb. Let's get them on a slab climb, see how that goes. If that's good, progress at this rate. So the document kind of spells out stuff that is intuitive for some people, but isn't for others. The lowering is pretty much the same, although if somebody has some cognitive issues, that can take a little bit. So practicing that down low, lowering to the bottom instead of the feet, like your butt. Um, yeah, those are probably the big ones. It's mostly just education and how to teach climbing well. There's
Mhm.
also the aspect of, which I love doing this, is looking at people's body position on the wall and knowing how you can instruct them to move. So say
Mhm.
somebody's, frozen in a spot. Yes,
Right.
there's the visual cue of the hold, but sometimes their body's just like in this weird position.
Mhm.
And just being able to like tease out what to do, like move your right toe over 1 inch, turn your knee out a little bit, move your knee over your toe, and then try and push up using like pretend like you're standing out of, a seat with that one leg, whatever, using just cues that help. And I find that helps immensely with
Yeah.
people climbing when they get stuck.
What other problems or challenges do clients with Parkinson's tend to need to overcome, or commonly are they commonly confronted with?
I guess, are you speaking of Parkinson's in general, or Parkinson's with climbing?
With climbing, yeah.
Okay. Um, let's see here. The biggest one is probably getting into the gym and out of the gym without falling.
Okay, yeah.
But being totally honest,
Hmm.
that's kind of a big one for some people.
Yeah.
And some people are in wheelchairs and stuff.
Hmm.
Um, so slowness of movement is something with Parkinson's, and if you climb slowly, it's hard.
Hmm.
you know, it's a training method for climbing, is to climb at the snail turtle pace. And you're like, wow, that's really hard to do because you're holding your muscles in engaged positions for such a long time.
Hmm.
And that's a tendency for a lot of people with Parkinson's, is to their the slowness and the rigidity, so you're just your arms kind of stuck in this bent position. And yeah, I could tell somebody without Parkinson's straighten that arm up, but somebody with Parkinson's, like, it would take a lot of effort to straighten it out. And that's what we're doing climbing, but that's
Hmm.
why that's probably one of the bigger challenges is probably the slowness and the stiffness with the movements. Uh, I would say the honestly the little bit of cognitive brain fog, not dementia, but a lot of people with Parkinson's just have that like slight brain fog, and I can see it on some days more than others with
Hmm.
people, and it's like some days it's like, oh, mapping out the route is really simple to do, and then the next day it's like, oh, that was the wrong hand there, wrong foot there, and usually you get that right, and so it's kind of
Hmm.
that can be another bit of a challenge, especially for the older folks we have climbing with us.
Yeah, makes sense. Do you ever run into problems where people aren't able to express what they need as much, like if or maybe they get stuck on the wall or um, things like that?
Yes. So voice gets quiet, and some
Hmm.
people, I've had some people in our group who barely really speak at all. And when that, it also comes back to being a good instructor and a good player and intuitive and watching body language on the wall,
Hmm.
kind of knowing when somebody is ready to come down, going to the side of them, making eye contact with people. So that is one thing that I teach people and try and watch people do is to kind of like get to the side and look at people and be like down, up, good.
Hmm.
Um, in general, I would say that's not a big factor with the group. I think the communication's pretty clear and good.
Yeah, that's great. So if anyone's listening to this right now and they have Parkinson's or know someone with Parkinson's and they're really excited about what we're talking about, and they want to find a gym near them, where would they go? And then also, how might somebody help out with the nonprofit?
Yeah, so our website, which is upendingparkinsons.org, there's a locations tab on there, and that has the locations we're currently working with, which I understand people could be from anywhere. We probably don't have a location near them. That the next thing I would do would be reach out to me. My email's on there, but it's also Molly at upendingparkinsons.org. And let me know where you live, roughly. I would look up the climbing gym in your area. Chances are I probably am emailing with them. So I'm emailing with so many gyms right now, I'm but if I'm not, then I could reach out to that gym and see if they'd be open to starting a program. What we need with our nonprofit. So the gym where I started at Sport Rock, we do it for free here. We offer it so many times, and I know other gyms will not be doing this. So we offer it 5 days a week at one of our locations, 3 days a week at another location, 2 days a week at our third location, all kind of in the same area. And it's free for people to come to. And so that's asking a lot of other gyms. So a lot of the other gyms are charging for it, and I get that it's a business. And so our ultimate goal with upending right now, we sponsor individual climbers. So if somebody wants to climb at movement in Golden, Colorado, it's X amount. They can sign up on their website and go to that. If they can't afford it, they fill out a form that's on our website. It's on the location thing, and we'll pay for them to go.
Hmm.
Ideally, we would pay for everyone to go to every program. So we'd pay the gyms, or at
Hmm.
least, a discounted rate at the gyms. Be like, hey, here's $10,000 to run this every year, for a year.
Yeah.
So funding is a big thing we're looking for right now. We are not funded. Our study was not funded. We are a relatively poor company working on that. It's not my strong suit. So I'm definitely looking for anyone that knows how to help with fundraising and that stuff. But in general, reaching out for volunteering for groups, for volunteering for helping to organize starting a group. And there's a number of things we could use help with. So
Hmm.
again, you could reach out to my email.
Okay, awesome. Yeah, and I know we don't have one here in Columbus yet, so Columbus, Ohio, so we gotta
No, you have two in what? Cleveland.
Cleveland, I saw, yeah.
Yep, two in Cleveland, and they're doing great. One of them just started a month or so ago. They already have 12 climbers. She just sent me a bunch of pictures
Awesome.
this morning. So they're flourishing. And I'm looking at Cincinnati, I think it is, right now too. The gym there I'm talking to, but we'll go Columbus also.
Yeah, yeah. So that's awesome. So that's how people can help. That's how people can find gyms. I think what you're doing is awesome. Like I said, love rock climbing. I love that it can help with patients who need neurological care. So this has been a wonderful episode talking to you. So
Yeah, it's been so awesome talking to you. Sorry for hanging up on you halfway. I hope I don't do it again here.
that's all right. I'll edit it out anyways. Um,
Yeah, I'm so excited that you invited me to do this and talk about it. I was thrilled. So,
yeah, hopefully by doing this, we can get more people interested, get more awareness there, get you more funding, get more gyms in more cities. So, yeah, that's ultimately the goal and ultimately helping people with Parkinson's live higher quality of life. So,
yeah, exactly. And when our study is done, I will send the information to you because I'm very excited to
yes,
show you and everybody else what I've been seeing.
yes, please do. I would love to see it.
Yeah.
Um, any closing remarks for those who might be struggling with Parkinson's and are kind of at a loss and, might find hope from something like this?
Yeah, so I don't have Parkinson's, but people who I know often ask me, you work with people with Parkinson's, aren't you like paranoid you're going to get Parkinson's? And I, well, first of all, it doesn't cross my mind, so I
Yeah.
get to say no to that. But even if for whatever reason, I got Parkinson's, I think knowing everything that I know about it and watching the climbers and the people I know progress and what their life is like, I would be way less scared now than I would have been before knowing a lot about Parkinson's. So
Sure.
I feel like that is maybe not super hopeful to people, but I feel like I've seen what exercise and what staying active can do, and that is what I would absolutely do. It was like 100%. I would never stop working out, and I'd probably do a variety of exercises. Obviously, I would climb, but I think just knowing what a benefit that is huge for Parkinson's. And it can't be understated because I have also seen what happens when people stop exercising and
Mhm.
it happens quickly. So
Hmm. Hmm. Yeah. I mean, it can't be understated, and I think people take it for granted, like how powerful can exercise really be or rock climbing really be. And like you said, you see the immediate negative side when they stop, and then the positive side when they pick it back up, and the proof is in the pudding. So
absolutely, yes. The other researcher called it penicillin. It's the penicillin of Parkinson's.
and penicillin was a big deal, is a big deal. So
Yeah.
um, but awesome, Molly. This was great, and I wish you guys nothing but success. And for all those with Parkinson's out there, I'm sure they're very appreciative of all the hard work you're doing. So,
Oh, well, thank you so much. I appreciate you.
of course. All right. Well, from Dr. Joe here at the Neuro Health broadcast, take care.